a fairly new medical procedure that's giving doctors a more accurate way to diagnose certain cancers without surgery.
And today, Dr. Daniel Cornett, a gastroenterologist with the Spectrum Health Medical Group, is here to talk to us about it. And talk to us, first of all, Dr. Cornett, about exactly what this procedure is and why really it's just so beneficial to have that here in our healthcare community.
Absolutely. So the procedure itself involves putting a scope into the gastrointestinal lumen, and we're able to look at organs outside of the gastrointestinal lumen with an ultrasound probe. And so it's a very unique test to be able to diagnose tumors and look at the pancreas and hepatobiliary tree closely.
Okay, so we all hear the word cancer, and that puts off a red bell in our head. What kinds of people can be helped by this? Are there certain people with cancers or certain issues that might especially benefit from something like this?
Absolutely. So this test will be a test that we perform in people that have a question of pancreatic cancer, hepatobiliary cancer. We can use it to stage tumors in the esophagus or the rectum. It really has four purposes. One's diagnostic imaging, another's tissue acquisition, so biopsies, tumor staging, and then intervention. So you're able to apply a potentially therapeutic procedure.
So you could actually maybe, in some of those instances where you discover that there is a problem going on, use this same exact procedure instead of something more invasive to do the full treatment?
Correct. So we can treat very superficial tumors with endoscopic ultrasound and something called endoscopic mucosal resection.
Okay. So explain the procedure to us, because I think sometimes people get a little bit apprehensive about going in and maybe doing something that's a little bit unfamiliar. You had said that a tube is entered, kind
Absolutely.
of to start it. So.
Absolutely. So the procedure is done with conscious sedation. It typically takes less than an hour. And the scope goes down at the esophagus, into the stomach, into the second portion of the small bowel. We inflate a balloon and use an ultrasound probe to look through the wall of the intestine.
Who's a candidate for this kind of a procedure, and is there a certain age threshold where this becomes something that's more regularly done, or does there have to be a red flag first?
Typically there's an abnormal finding on a CAT scan or something that the primary doctor finds on a lab value that would prompt this test. There are different indications would be to look at the pancreas, to look at the bile ducts, to look at the liver, and to look at something called submucosal lesions, which we see inside the stomach and small bowel.
So this is something that's relatively new to Spectrum Health, something you weren't doing before, correct?
Correct. This is a brand new procedure for Spectrum Health.
Okay, so if somebody wants to get a consultation with you, do they just need to call and set it up? Do they need to have a conversation with a medical professional?
Absolutely. They can call our office and we can talk about setting up a clinic appointment.
Okay, and that's just the first time appointment would be for evaluation, and then you basically decide from there what the next step is?
Absolutely. Some patients I go ahead and do the procedure based on the imaging and discussions with their referring doctor. Other patients like to see in clinic first.
Okay. Well, thank you. That's been a learning process, and it's really good to know that there are those tools out that are close to many of us to be able to help with our health care.
And you can't help think what this is going to mean for long-term survival rates, because pancreatic cancer is just such, it's a real scary one.
It is a very scary one, absolutely. 1 in 80 people get pancreatic cancers.
Wow.
Wow. All right. Thank you so much for joining us today.
Take care.
We'll be right back.